Well, welcome everybody. Good afternoon. I'm not Beverly Coleman. I'm Lisa Lockhart. I'm happy to see everybody here. And I appreciate your attendance. I think it's really important that we try to iron out a few things in regards to our regular agendas. Jennifer Wiseman has offered to be of assistance with that. Because we have lacked a little bit of structure, and I would love to see that reined in, and I'm so appreciative of the assistance. So if everybody could just introduce themselves so we know who all's here. I'm Lisa Lockhart. I'm a K&A representative. I'm one of their liaisons to the board.
And I'm Jennifer Wiseman. I'm a nurse anesthetist. I was nominated by the K&A as well. And I'm currently president of the Kentucky Association of Nurse Anesthetists.
Awesome.
Mm-hmm.
And I saw Dee Polito.
Trying to unmute. Hi, I'm Dee Polito. I'm a certified nurse midwife, and I'm the treasurer of the Kentucky affiliate of American College of Nurse Midwives. I'm on faculty at Frontier Nursing University. I am also the team lead for the Institute for Medicaid Innovations 3-year midwifery learning collaborative, which I can give you more details about later on. There are other members of the IMI on the call today from our MCO partners. And so excited to talk about that. And normally in Lexington, but I'm visiting family in Pittsburgh for a long weekend.
Well, thank you for taking time out of your visit to join us, Dee. We really appreciate that.
My pleasure.
Who else have we got? I know Charlie's on the phone.
Yeah, I've got Sharp. I'm here from Medicaid. I'm the liaison for the TAC with the Department for Medicaid Services. Dr. Terrio, would you like to?
Sure. I'm Judy Terrio. I'm the medical director at the Department for Medicaid Services.
Angie Parker.
Give me a minute. Hi.
Those mute buttons are terrible, aren't they?
I am Angie Parker. I'm the Director of Program Quality and Outcomes for the Department for Medicaid Services.
And Beverly is joining, so we'll be just a minute getting her joined. Eddie Newsom, you want to introduce yourself?
Yes, my name is Eddie Newsom. I'm a branch manager in policy and operations on the benefits side in Medicaid.
And Jenna Jolly.
Hi, I'm Gina Jolly. I'm a nurse consultant inspector with benefit policy and the Department for Medicaid Services.
And I thought I saw Justin on here earlier, but I'm not seeing him now. But that gets all the Medicaid staff that's on the call at this time. And I don't know if you heard me say that Beverly has joined.
Oh, wonderful. Hey, Bev.
Hi.
Oh, there she is. I was going to say, I know I saw her coming in, but then I didn't see her on here.
Well, welcome. It looks like we got a nice group. Beverly, we're glad you're here. So we've just been welcoming, and you didn't miss much, doing introductions so that we would all know who was on the group. When we are looking at our agenda.
And I've got it pulled up here, Lisa. And one thing that I failed to have you all add on here, actually 2 things, is the approval of the minutes from the last meetings, and also setting your all's dates for 2022. So
Okay.
if you could do both of those things in addition to your regular agenda items, that would be great.
Okay, great. Thank you. So, well, Beverly, you want to take over, or you want me to keep going?
if you don't mind, I just got out of a meeting and I just got in my car. If you can keep it going, I'm listening.
Absolutely. Not a
Okay,
problem.
thank you.
You're
Thank you so
welcome.
much.
Okay, approval of minutes. Has anybody had the opportunity to look at the minutes from our last meeting?
I'm pulling up my emails.
I'm pretty sure I sent those out probably about 2 weeks after your meeting. And I'm looking here to see when that actually was.
Honestly, if you could pull them up again, maybe resend them very quickly. They're maybe buried so deep
Mhm.
that it might take us more time to dig them out than
I
for
think that's a great
us
idea.
to see them again very
Mhm.
quickly.
Because I remember looking at them, but
Yes.
And that all depends on if I've actually saved them over into y'all's file folder. Here we go. Let's see.
The September 9th meeting.
mhm.
Yes.
I just sent them back out to everybody.
I'm looking at them now.
And it's actually got the whole transcript, and then it has a summary of just the minutes to look at.
There we go.
Thanks for that, Charlie. I'll make a motion to approve the minutes as written.
I'll second that.
Very good. Thank you, ladies. Thank you,
Mhm.
Charlie. We appreciate the support. We do. Getting us on track here.
No problem.
We're gonna miss you when you retire now.
They'll have somebody else to help you out.
We may be a little lost. Okay. Okay, next on our agenda, whoops, I just made myself very small for some reason. How did I do that? Okay, next on our agenda is the item marked discuss the list of MCO COVID vaccine incentives. And that was a handout that was sent to everyone.
I had just mentioned putting that on our list to discuss because I got that information when it was sent out from the department, but I have not seen that distributed. And mind you, I'm not dealing with the population daily who would be receiving that. I see people quickly and then put them to sleep. So I don't have the opportunity to pass it along myself, but I was curious if that was being brought up in any of the other TACs, if there were any initiatives in like the childhood health TAC or like the primary care TAC even, or the physician's TAC, to see if they're doing anything to get that out to providers. And I'm still trying to learn, what we discuss in here, what should be taken back to associations or professional memberships. And I think this is something that could probably be taken back to Dolores over at KNA, and for her to distribute that to at least all the nursing providers, or even just nurses who are, working in areas where that could be distributed to Medicaid patients.
Jennifer, I will tell you that this was distributed to all the TACs. And of course, one of the things that we do like for the TAC members to do is anything we get out to you all, such as this, or I know I sent out a notice about public comment, I think, on some of our waiver programs. And so certainly we would like for you all to share that with the Kentucky Nurses Association and other TAC share it with their association, like the Kentucky Physicians TAC and Pharmacy and so forth. And what we would love to see happen is if the Kentucky Nurses Association has like a fax blast or an email blast and that type of stuff, or even a newsletter.
They do. They do. And I
can.
can make sure when I usually do a summary after our meetings and submit it to Delanor. And
Perfect.
I can do that along with the attachments that we had sent out for this meeting. I'll make sure that she gets all of that so they can distribute as they see fit.
Yeah, that'd be great. And of course, I mean, when you all introduced yourselves, you introduced that you were members of numerous different associations. So anything, because we posted it on our website.
Okay.
On two different places. We have a member page that we posted it there. And we also posted it on our Medicaid COVID website. And I'll let Angie address it more, because me just coming back to work on Monday, I don't know what all they had done beforehand. But I do know that, and I know other TACs have had this. Now, December's the slower month for TAC meetings, but the ones that we've had this week, there has been some discussion. But Angie, do you know, are the MCOs doing anything with the list also?
What do you mean by the list?
That handout, I'm sorry, not list, handout with the COVID incentives, the COVID vaccine.
Are they giving that information out?
Yes.
Is that the question?
Yeah. Or did we distribute it any way other than the website and the tax and max?
No, well, I mean, each MCO has a copy of it. They supplied the information to me. I put all the information side by side in order to share that with the MAC and the tax, as well as to be put on our website.
Okay.
Now, you know, the MCOs are providing their individual information to their members. If
Right.
that's the question.
Yes, thanks, Angie. I knew that had been created prior to me coming back, so I didn't know what all had transpired other than what the tax have done with it.
I mean, each individual MCO has been doing a lot of work in trying to get not just incentives, but contacting persons to either assist in transportation, to get their shot. Some are actually going to their homes to give the vaccination, emails and text messages, and encouraging members to get their vaccination, along with and let them know about the incentives. I don't know if all the MCOs are here today, but they may be able to give a little bit more specifics on what they're doing outside of the incentives, but it's pretty much educational, and they are very much engaged in getting their membership vaccinated for COVID.
Yeah, and this is Stephanie with Anthem. We're actually, providing dollar incentives. We're giving $100 for COVID, specific to COVID vaccine for ages 5 and up. They get to see
I was
those.
just looking at that. I think that's wonderful.
Yeah, and then we've got the whole list of
Confusion
provider incentives as well. Yeah.
Is there, just from a patient perspective, is there anything that these patients have to do after they get their vaccine, as far as like turning in documentation and claiming, or is this like a streamlined process where they automatically get the incentive if they get the vaccine?
Ooh, I don't
Well,
know.
there are certain things that they do have to do, and the COVID vaccine incentives that was sent out to all the TACs, and I guess maybe you may not have received that. It does provide the information on how the incentives can be obtained. They are different for each one, each MCO.
I'm pulling that up. I got the sheet that you put
Okay.
together, like the columns and with each MCO, and it was very helpful. But I was just trying to make sure if I was, spreading the word around, that I was correct in what I was passing along. As far as this isn't automatic, like there's a step after you get your vaccine.
I believe one of the MCOs, they wait for the claim payment and then they reimburse, but there are others that they would have to go online and provide a copy of their card or attest to it and provide the dates. But each of the MCOs on that sheet that you're looking at shows how to obtain the incentive.
I guess my only other suggestion, I think it might be wise if we give this to some of our nurses who are kind of leading the way in the school nursing program to make sure that they're informed and aware of this. I don't know
I
their.
can do that. You mean for K&A, Kathy
Mhm.
Hager and all that group? I can do that.
Yeah, and a lot of the clinics, that Delnor kind of recruits for volunteers for.
She does. Yeah.
A lot of these vaccine clinics are run by us K&A members. So we may just be volunteering to do that, on the weekend, even though our normal job doesn't give us the opportunity to spread that around. So I think just distributing that through that kind of chain, and maybe even getting it involved with our school sites could be helpful.
Okay.
In my
I will make sure that is shared.
I'm also going to suggest that the Kentucky Coalition of Nurse Practitioners and Nurse Midwives have a great understanding of the incentives. They may already, but maybe they could put it on their website as well.
It's a great idea. Get the word out, right, ladies? Anything else on this topic? I think we have a plan to get it distributed to the appropriate K&A board members that can make some action happen with getting this distributed the way it needs to. And I'll be making sure that that happens. I'll put the report together tomorrow and get it all sent out tomorrow. Anything else? This is very helpful, though. It's very helpful. A lot of people will find this very helpful information. Okay. All right. With that said, Dee, I think you're up next.
All I have is midwifery to talk about. So I may have mentioned previously in this TAC that I am the team lead for the Institute for Medicaid Innovations Midwifery Learning Collaborative. They really put together a solid overview of the benefits of midwifery care for the Medicaid population in an 8-series, a series of videos and things to read. They put it out over 8 months last year, and it is available to anyone that wants to review it. There are pretty lengthy. If there are participants that are engaged with the IMI in the Learning Collaborative for Kentucky, we're all asked to make sure that we have those under our belts and review them. But Kentucky was one of only 5 states chosen for this initiative, and it will last for 3 years. And it it is associated with honorariums, not only to the providers that are participating, the nurse midwives that are participating, the certified professional midwives that are participating, but also the community advocacy groups that are participating in the Learning Collaborative. And it's really designed to bring us all together from different levels to determine what we can do to advocate for more midwifery-led care in the state. One of our big objectives is to address the lower reimbursement for not only CNMs, but the fact that CPMs are not reimbursed by Medicaid at all. So that's something that we're focused on and addressing, but also that there are no birth centers in Kentucky, and Kentucky is one of only 9 states in the country without a birth center. And a birth center is can be freestanding, but it can also be an alongside center within the walls of a hospital that is providing midwifery model of care only. And so we're in the early stages of figuring out how to put everything together and move forward. And we've done a root cause analysis. We're going to be doing very targeted assessments of each individual stakeholder to determine what are our goals for the next 3 years. So we're moving forward with that. And I'll also add that all of the providers that were eligible to receive an honorarium in Kentucky's collaborative chose to pass those honorariums on to the community advocacy groups, which are Kentucky Birth Coalition, Kentucky Voices for Health, and also Hope's Embrace. So I just wanted to keep everyone up to date on that very important initiative. I know Stephanie is on the call today, Holly's on the call today, Angie's on our list of participants. And if anyone had any questions or anything that I can take from this TAC to that learning collaborative, I'm very happy to make that connection. I'd be interested in Dr. Terrio's perspective or impression of Kentucky being chosen for that learning collaborative.
I think it's awesome. I think it's great. It's something to be proud of. And I think we're going to do great things in Kentucky.
I will add that we don't have physician representation on the collaborative yet, but we think it's very important because all voices should be at the table when it comes to maternal, perinatal health, maternal services in Kentucky in general. So we might be reaching out to you, Dr. Terrio, to maybe provide some perspective in a work group of some sort in the future.
That sounds fine.
Thank you.
Oh, I forgot that thing was up there.
Nice sweater. That has got to be the ugliest Christmas sweater I've ever seen.
That was from a previous meeting that's today.
Oh, that's adorable.
See the other little squirrel.
Wow. Any other questions or comments about the IMI?
Well, the thing that keeps coming to my mind is I can remember the first time I listened to some of you all present the idea of the disparity in healthcare in relation to our prenatal, our underserved population, our Black and brown population, our illegal immigrant population. And I'm wondering, do you think this might have an impact in some way? Because the data you all shared just made me sad.
Are you referring to the maternal mortality that
Yes.
Dr.
Yes.
Terrio presented last meeting?
Yes. I mean, it's a significant difference. It's it was disturbing,
Well,
that in this day and age, we still have that, was disturbing. So
absolutely. And health equity is something that's in the forefront of our work. And we try to put everything that we think about through the lens of making sure that we're providing equitable suggestions so that it reaches underserved populations. So that definitely is something that's at the forefront of our initiative. We also have to address the high maternal mortality related to substance use disorder also in Kentucky. So it's right at the top of our agenda.
Wonderful. Thank you all for all your work in this area and for sharing it.
It's quite robust and is very, very detailed, and the steps that we're taking through the IMI's foundational work really allows the extrapolation of the exact problem. So far, we're coming up with the problems of obviously reimbursement, lack of understanding, lack of knowledge about midwifery care and how it can be impactful to improve outcomes. So, with that, I can segue into a very interesting article that I came across in the Journal of Midwifery and Women's Health in October. And it really broke down the cost of providing low-risk antenatal care in relation to what the Medicaid reimbursement for that care is on a state-specific level. And obviously the total midwifery provided care is more cost-effective, is what the evidence tells us. But it also varies widely from state to state and is the reimbursement is less than what the cost of providing the antenatal care is in terms of the bundled global fee that's paid for maternity care. And so if you just break down what antenatal care costs between a physician that does it and a nurse midwife that does it, it's quite surprising to know that Kentucky really isn't doing too bad when compared to the other states in the country. In Kentucky, the cost of a certified nurse midwife is about $600 per pregnancy global billing package. And it's about $1,200 for physician care. And if you calculate the overhead costs, there's a margin of a loss of $77 for each pregnancy global fee or global billing package for CNM care. But the margin for physician care is a loss of $310 per global billing package. And that's in Kentucky. Kentucky really doesn't do too bad. And if you compare to, say, Ohio, the margin for CNM care is a loss of $58, but a loss of $500 for physician care for the global billing package. So I just think it's, more evidence is coming out that midwifery-led care is much more cost effective, and in terms of providing Medicaid recipients or participants with that care is vital. So we have to get more midwives into the system. And one thing to consider is reimbursing certified professional midwives who also have positive impacts on maternal outcomes. So I shared that via email with everyone, so you have that to reference.
Thank you very much.
Anything striking or anything to discuss related to that evidence that I gave? So I thank everyone for your attention to the midwifery part of it in the prenatal and maternal care discussion that I have to present today. Thanks.
Thank you. Thank you very much, Dee. Okay. Well, we're just moving right along here, guys. That was all very interesting. And we'll make sure that that gets shared as well with the K&A board. So thank you very, very much. Okay, does anybody have anything else before we move on to setting our dates for the coming year? That's a big one.
I just wanted to throw out one thing. The White House did a maternal health summit earlier this week, and I don't know, I think it was earlier this week. I don't know if anybody listened to it, but it's on, it's recorded, so you can go back and listen to it. It takes a while. It was like 3 to 4 hours long, but it was very good. And it talked about midwifery care, talked about doulas. It had some great personal stories. And so it's worth, you know, they're launching a big push to improve maternal health and decrease maternal morbidity and mortality. So if I can find the link, I'll send it out to you guys.
That would be nice. Thank you. Anything else? Okay, all right, great. Thank you, everyone. So I guess we can move on to looking at what our meetings are going to look like for the coming year.
So you all are currently meeting like the second Thursday of every other month. And basically started, that would start, so you would end up at, because y'all are new tax, so you kind of started late in the year. Start with your February would, and I quickly went through and wrote these dates down. February the 10th, April the 14th, June the 9th, August the 11th, October the 13th, and December the 8th. Now, those are just based upon what you have done since you've been have restarted back up again. It's your tax. You all decide on what days you want to meet. But if you want to keep them like you've been doing, that's the dates that you would meet for next year.
What does the group think?
I'm fine with keeping those. I don't know, is our plan to keep everything on Zoom? Is that going to be our plan?
Yeah, that was going to be my next thing to bring up too, be Zoom, and plus any topics that you might want to have for your next meeting as well. And especially if you want some kind of data or anything from Medicaid, if we can, if y'all know you might want that, we can start working on it from this meeting.
I had suggested in that email too, that we just double check. I know all of our associations and K&A and everybody are closely monitoring any regulations that are going through that affect nursing. So I think that just so stuff's not missed and we can go back to our groups and talk about it, it might be a good spot to look at those here.
Okay.
And not only regulations, but any, because we got the the legislative session starts up in January. So there could be bills introduced that y'all may want to look at.
I agree. So I feel like a lot of stuff that affects nursing kind of starts, on the legislative slide, and then they direct the cabinet to promulgate the regs. So I think that this would be a good place. I looked, the only reg that I see out there right now is the reimbursement of telehealth services regulation that's out right now. It's been filed. It's open, I think, for public comment till the end of the month. I don't know if any of you all have looked at that.
Know that the coalition will be pursuing again this legislative session, the removal of the Kappa CS for advanced practice nurses, and then
Yes.
the Kentucky Birth Coalition, but also just all of the stakeholders in midwifery will be also pursuing the bill to exempt birth centers from requiring a certificate of need. It'll be the third year that bill is put forward. Actually, the second year, and no, it is the third year that it'll be introduced. So we'll be watching both of those pass through the House and the Senate.
And is all, and this is just because I'm not 100% sure, but is the whole birthing center certificate of need stuff, is that for all midwives? Because I know the KBN now is in charge of just the professional midwives too, not just clinical nurse midwives. So is that something that's related to all midwives, or is there like a separation between what is going to be the nurse midwives versus the professional midwives?
Great question. Yes, the Kentucky Board of Nursing now licenses CPMs. There are, I think at last count that I knew, 28 CPMs that were licensed through the KBN. And yes, birthing centers can be staffed by CNMs, but also CPMs in other states. They do work collaboratively. The birthing centers that are called alongside midwifery units that are in the walls of hospitals in Kentucky, I doubt that you will see CPMs go into hospitals, but that is always a potential. And in other states there are, that does occur. So we're just hoping to build one. We just would like to see one in Kentucky. And the certificate of need issue is being pursued because one certified nurse midwife attempted to open a birth center in 2012, and it took her 5 years and many battles in court to try to obtain a CON, and the 3 hospitals that were around her blocked it. They opposed it. And eventually the courts sided with the hospitals that she had no need. There was no need for a birthing center because the hospitals provided those same services. But in reality, it's a totally different service. So that's why we would like to see the certificate of need be not an issue for building a birth center. So yes, that's the long answer to your question.
Are the
yes.
professional midwives, the 28 of them, are they eligible or joining in with the coalition?
The coalition, the Kentucky Coalition of Nurse Practitioners and Nurse Midwives, we don't have any reach out from the CPM group to, collaborate or be involved as of yet that I know of.
Okay. And then the, like I said, I know I've looked through the telehealth stuff recently. I don't see any real if we talk about a regulation that's already been filed, Charlie, and we had a suggestion, do we just file a comment as a TAC, or do we just send our suggestion to the MAC and the MAC take it forward? Like, how does that work if something's already been filed?
If it's an administrative regulation, you need to go through the process for the administrative regs, which is, I believe, commenting through, I think there's a general email address.
There is.
And you would just comment through there.
Okay, so we wouldn't comment as a TAC. We would discuss it here, and then I would go make a comment on something.
I was going to say, if each one of you
when they do the report out.
Yeah, you can each one make comments, or if you wanted the what's Delanor? Is that the lady at the Kentucky Nurses?
Yes.
if you wanted to take that back to her and have the Kentucky Nursing Association make the comment on your behalf, or you can make them individually. But yes, for the regulations, they do need to go through the administrative regulation process, because that's all set in statute.
Right.
Gotcha.
And while we're kind of on the topic, and I know this is a great y'all are a new TAC, it's a great opportunity for you all to get together and talk about all things for the nurses or the Nursing Association. There are some things that are out of this is a Medicaid TAC, and there are some things that y'all have brought up that are out of Medicaid's control. So I just wanted to kind of touch base to remind you that since it is Medicaid, we kind of want to keep it to Medicaid topics.
Right.
So just want to put that little general reminder out there to you all. Thanks,
Yes.
ladies.
Thanks, Charlie.
Thank
Yeah,
you.
I'm trying to just understand the process, and when the information comes to the TAC and we make suggestions to the MAC, where in the process of the department forming things does that occur?
Okay.
I guess that's what I was trying to clarify.
Okay, I can do that for you also.
Thank you.
If you all as a TAC have any recommendations on something other than possibly the administrative regulation,
Okay.
and I say that again only because that's all set in statute, but if you have any recommendations from this TAC that you want to make, and just for instance, if you wanted to put out there that you would like to recommend that we start providing services for midwives or reimbursement, that would be a recommendation you all would make. You would vote on that recommendation at your meeting like today.
Okay.
At the January MAC meeting, one of you all would present that recommendation to the MAC. The MAC typically at the end of every TAC making their recommendations or making their reports, they just typically vote to say we accept all of these recommendations. They've never gone through and said, well, we don't want to approve this recommendation. They just recommend them as a whole. And then from that, the department has 45 days in which to respond back to you all and to the MAC.
Okay.
And just, we have to look at it from the budget part of it. So if it is something recommending that we start covering a service, or we start reimbursing more, we start reimbursing for something that we're currently not, we have to look at budget. So it doesn't necessarily mean that your recommendation will be approved, but I will promise you that we do look at each of the recommendations and try to make the best choice for our Medicaid members when we're doing this.
Perfect. Thank you for clarifying that.
You're more than welcome.
I think it's a good spot if there's a Medicaid reg, even if it's one of the administrative regs. I think if we can at least bring it up here so that we're all aware, we could take that back to Delano to see if K&A needs to chime in or do anything. That would be appropriate. And then anything else, we'll just suggest, I guess, to the MAC, as we'll vote on it here, like she said. We can just add that little blurb to our future. I was just looking through the agendas of the other TACs to see what all they were discussing, and had kind of just followed their lead on a structured agenda, which is why I sent those 3 out today.
Uh-huh.
I think that's a great place. I think we're doing good things.
Mhm.
And even, for
Great
instance,
questions.
if you all don't have recommendations from today's meeting, if one of you or the chair or vice chair or either of the others want to make a report to the MAC in January, you can still do that to just report on the items that you discussed and some of your some concerns, or if we're doing a great job, like for instance, if you wanted to say y'all thought that the the incentives the MCOs were doing was a wonderful way to try to get more people to get the vaccine. You're more than welcome to go and make those reports to the MAC, even without a recommendation in them.
Okay.
Well, yes, and the positive comments about the MCOs and the incentives for COVID vaccine would definitely be one. But the other thing, team, in my brain is we've now had several conversations in regards to midwifery and maternal health and mortality and morbidity and healthcare inequity in our maternal health population. And I can't help but wonder if we do not have an opportunity with D especially to make some sort of recommendation in regards to if this team thought that was appropriate. And of course, we would need to discuss that with the K&A board. We could, I would highly recommend doing that first. But in regards to the funding of midwives that we were talking about.
So perhaps we can take the issue of certified nurse midwife reimbursement, which is one issue, and make a recommendation that the CNMs in Kentucky should be reimbursed at the same rate as physicians. And then the second recommendation would be that the certified professional midwives, because now they're licensed by the Kentucky Board of Nursing, be reimbursed, period. They're not reimbursed at all by Medicaid. So those would be two of my suggestions that we could make recommendations for.
Okay. We'll make sure we take that to the K&A board as well. But it just seems to me the most logical steps to make after all the presentations and the facts and the research that has been presented to us.
Indeed. Teresa in the chat asked if you could explain just the educational background for the CPMs.
Right. The certified professional midwives have their own path of certification. They have their own midwifery educational programs that are, I guess, certified by the North American Midwives Association. I would have one of the representatives for the CPM Advisory Council that I work with on the Board of Nursing can speak to the educational requirements that CPMs have. Not all states license CPMs. I think there are only 13 left that do not license CPMs. So if you'd like more information specifically for CPMs, because I'm not a CPM, we can have someone speak to the exact educational requirements. There are a specified number of births that they have to attend with another CPM. It's very similar to the midwifery education that advanced practice nurses go through to become certified nurse midwives, but it's more community-based, meaning that their focus is more birth center and home birth. So it's a little bit of a different model of midwifery care. For example, I was educated in midwifery, but I don't have any huge knowledge about home birth. And there's a lot of things to take into consideration when you're taking birth outside of the hospital. Think provisions that you have to have in place, backup providers that you have to have in place. Which I don't have any education or experience about, although that's something that I could obtain if I chose to practice home birth, which we do have certified nurse midwives in Kentucky that do practice home birth. So it's different, but it has many similarities.
So my suggestion, and you can tell me I'm crazy. I think, because I think we're going to be talking and coming to the table with things that we may know very well, but everybody else doesn't know well,
Yes.
whether it's us, other nurses, or some of our MCOs on here, or whoever's on our call. So maybe we can set up kind of like a rotating agenda. So like Dee brought that up today. So maybe at our next, so we can all, like, in our spare time, look up that issue. Maybe we can come back at our next meeting, discuss it amongst ourselves, a little more like educated and knowledgeable about the topic.
Yes.
So we have something specific to present to Delanor before just throwing out like just an idea, because then that's going to put, I mean, the only thing I can say now is sure, sounds great, or no, doesn't sound great. Like, I truly
Yes.
don't know enough to even make an educated statement on it, really, because I've personally never worked with or dealt with a professional midwife at all.
Right.
So I think, and I think that could go with anything, because I know if I come with something anesthesia related, people might look at me like I have a third eyeball. And I think we should just take our time, just look it up, plan on in January having, like, Dee can bring us some, you know, like a little brief handout we can attach to our agenda, or email out amongst ourselves to read, kind of like other board meetings, you know, like a packet to read before showing up. So we have a little information, and then we can decide how to present that to Delanor and what we would be asking K&A to support us on, or what we would be taking to the MAC. So it's not all jumbled in like little bit. It's very like a structured suggestion with data.
Agreed.
So I think that should be on our agenda next time. Is obviously, if that's Dee's suggestion, she can send out what she wants for us to know. We can all look up whatever we want to look up on our own, talk to our association, talk to Delanor, come back together, discuss it, and then have a formal suggestion to the MAC with Delanor's approval. You know, so that way after our next meeting, we can just tell her and she can say yay or nay. It's not drawn out from that point on.
Right.
We can kind of get
That sounds very reasonable to me.
I just think if she had questions, or K&A has questions, of anybody or any of the associations want to chime in, we have a little bit of time to address those, so that we can come to the table addressing those. And it's not like we make a suggestion and then we wait another 2 months, you know, to answer those questions. And then now there's more. It's kind of just all get it all on the table at once, and we're all on the same page.
We could have the Kentucky Birth Coalition present. So get the, you know, from the horse's mouth, what.
Right. I can have the really leader of the Kentucky Birth Coalition, her name's Mary Catherine DeLoder, be able to speak on the differences between CNMs and CPMs. I can have a CPM come and speak. I can gather some information and have some links to send out to get some more information about CPMs. So the two real, you know, suggestions that I have from my perspective is the number one issue that CNMs are reimbursed at the same rate as physicians, but then the second issue would be the CPM issue. So really there's two different things to talk about. So I'm happy to provide more information about the CPM part. And then what I sent out for some pre-work for this meeting was really the big study that was done that broke down the state margins between CNM care and physician care, and then the margins that occur because antenatal care is expensive and we're really losing money from a provider perspective.
Right.
And so we for sure need to hit what Teresa's talking about when we discuss this next time, which these minutes will be sent out so we can refer back to these, but the educational background of CPMs, information from the KBN on licensing and continuing education and all that, and how that differs between the two. And then as well as making sure that if this is something we suggest, that we can show with evidence how this is going to alleviate some of the disparities that we're seeing.
I agree. Thank you.
And Lisa,
Yes.
just in case y'all haven't seen, there's been a couple of comments made in the chat box. There was one about the vice president's call to action on to reduce maternal mortality and morbidity. And then Dr. Terrio shared White House Summit on Maternal Health link.
Yes, I got that. And Jennifer Wiseman was actually just addressing the comments that Teresa had put in there.
Okay, all right.
Yeah.
Sorry.
No, that's okay. Thank you for keeping us on track, because sometimes I don't know. I personally don't always notice the chat when I'm engaged in a conversation.
Yeah, I sometimes forget the chat's there myself.
I do, because I'm talking and listening, and so that's. I feel really kind of charged about this conversation, like we're this very positive and some direction to what we're doing, and I feel really good about that. I hope everybody does. So we're going to set about educating ourselves between now and when we meet again in February. Dee, you're going to send us, and Dr. Terrio could send us education to share with the group, or links that we could use. We also have the link that's been provided to us regarding the summit at the White House. So we've got some homework to do, I think. And this will be on our agenda for the next time that we meet.
Okay. And so the rest of the meeting dates for the rest of the year, we're okay with everybody as well?
That was my next question. I know two people chimed in. Was everybody, all of you all okay with the meeting times proposed?
Say the dates again.
Okay.
February
February.
10th. Oh, go ahead. I'm
Oh,
sorry.
I'm sorry, Lisa, if you got it, you can go ahead.
February 10th, April 14th, June 9th, August the 11th, October 13th, and December 8th. It's keeping us on the same rotation we've been on every other month, Thursdays.
3 p.m.
3 p.m. still. Yeah,
Perfect.
that seems to work well for everybody.
I will tell you, I will be on campus during the February meeting. I go to campus 2 weeks every term, and I am completely unavailable to do anything else at that time. I may be able to break away for the 3 p.m. meeting on February 10th, but I can't commit to it at this point. So we may table the CPM part discussion for
April.
another time.
Mm-hmm. Okay. Well, we'll keep it on the topic list, and you get feedback to us at what you're able to do.
Will do.
Okay.
Sounds good.
Okay. So is everybody okay with the meeting times? Am I hearing that an okay for that?
Yes, ma'am.
Okay. And we have some education, and we have a plan where some things are going to be distributed to us. We already have a link to the summit, and hopefully everybody was taking some notes, and we're going to have the minutes that Charlie always provides us with to help guide us if we can't recall because we talked about a lot. There were a lot of really great questions and a lot of good topics that came up about a topic that we're all very interested in. But I am with Jennifer. I lack a lot of knowledge when it comes to midwifery. That is not something I'm experienced with at all. So I've been learning a great deal just from the conversations we've had in here. And like I said, that's why the data was so eye-opening to me. So very much appreciate that. Okay, so we have our meetings. We have a tentative agenda for our February meeting. We have homework to do. Is there anything else? We're going to have a more structured agenda next time. We're gonna work on that. That's been a little bit hodgepodge because we were just trying to get our feet underneath of us. But we've got some really nice formats, and I know Jennifer has volunteered. We can work together to make something a little more representative of the group. So because I think that we're starting to feel ourselves out here a little better.
Can
Okay.
I make a suggestion that we hear from Medicaid and what maybe a question or an issue that they would like to have more information about from a nursing perspective?
Oh, absolutely.
Yeah, that's good.
Let me see who we've still got. Deputy Commissioner Cecil, would you like to? There she goes. I was gonna say, sometimes they get on the phone on it and have two meetings going at the same time.
Oh, but I've not been distracted or multitasking. So I appreciate the question. We don't generally have tax ask us. So thank you very much for that. And for those of you who do not know me, my name is Veronica Judy Cecil. I'm the Senior Deputy Commissioner here at Medicaid. I can't think of anything off the top of my head, but we'll take it back. And again, just appreciate the offer to dialogue and for us to ask questions of you all.
Thank you. And so we'll turn it back to you guys, or you ladies, I should say.
I'm just jabbering away with a muted mic. Well, then we feel like we're in a position that we could draw this to a close?
I think so.
Yeah. Okay. Dee, what about you?
I don't have anything else to add. Thanks.
Okay. Beverly, are you still with us?
Yes, ma'am. No, I think that's everything.
Okay. We talked about a lot. I feel good about that. Does anybody else on the call have any questions for us or comments or anything they'd like to add at this point before we draw to a close?
This is Justin Derringer. I just wanted to thank you all for the information and presentations, and it was very helpful. I think y'all did a wonderful job, and so I enjoyed the dialogue and listening and learning, and I just wanted to thank you all for that today.
Thank you. Thank you. Okay, can we have a motion to adjourn then?
I'll make it.
All right, Jen, thank you. Can we have a second? Yeah, okay.
You all have
All
a
right,
nice
everybody.
holiday.
Listen, happy holidays, everyone.
And to you all too.
Thank you, you too.
Stay safe.
Mhm.
Bye. Thank you.
Bye-bye. Thank you very much.